Hi, I'm David Kornguth at Golden Gate Cancer Center, bringing you another video about prostate cancer. Today's video is about hormone therapy. Now, hormone therapy for prostate cancer has been used since 1941. I'd like to talk about what it is, why we use it, what kind of side effects you can get, and how do we reduce side effects. Prostate cancer is something that loves testosterone, and so we use hormone therapy or drugs that reduce testosterone as part of your treatment regimen. So for many kinds of prostate cancer that are anything other than that early stage 1 prostate cancer, we often will start by suppressing testosterone. The radiation typically begins a month or two after hormonal suppression has started, and men will be on hormone therapy for some period of time depending on the seriousness of the cancer, sometimes as short as 4 months, sometimes as long as 2 years. It all depends on your specific situation. Men are concerned about side effects of hormone therapy, as all of us are. The most common side effects of hormone therapy are hot flashes, reduced sexual desire, sex drive, libido, decreased energy. The hot flashes are probably the number one complaint in the clinic. Men will feel like they wake up at night. Sometimes they actually have to change their shirt because we sweat so much during the day. You just get this sort of feeling of warmth that kind of washes over your body. Kind of comes out of nowhere. The first time it happens, people aren't even really sure what it is. The hot flashes persist throughout the period of hormonal suppression. A normal testosterone in a guy over age 60 is somewhere between 250 or maybe 500 nanograms per deciliter. When we suppress it, we're bringing it down below 50 nanograms per deciliter, sometimes below 10 nanograms per deciliter. These are very low numbers. So you really do feel different. It's rare that people don't notice anything. We do have patients who actually are able to remain sexually active during the period of hormonal suppression, but that's the exception, not the rule. These hot flashes, these side effects of hormonal suppression are independent of radiation, and they do tend to continue for that whole period that you're suppressed. What can you do to reduce these kinds of side effects? The number one thing is to be aware that it's very easy to gain weight when you're taking hormonal suppression. So you want to make sure that you're kind of watching your caloric intake and minimizing the amount of carbohydrates that you're taking into your diet. We generally recommend that a third of your calories are coming from protein, a third from fats, and only a third from carbohydrates, but the average American diet is going to have carbohydrates represent more than 50% of your daily caloric intake. So you want to really be careful about that and do some monitoring. Talk to a dietitian or your primary care physician for some guidance around these issues. You want to minimize alcohol intake, alcohol consumption. You want to make sure that you're doing something on a very regular basis, and this may be the hardest thing, to keep that core strength up. And what I mean by that is that the hormone therapy tends to give you the sort of flab around the middle sort of abdomen, which can be quite a bit of a change, even for people who have been in very good shape their entire lives. And so things like crunches or partial sit-ups, what we call bridging, where you're lying on your back and kind of putting your butt up in the air, and you're doing these exercises, say 20 repetitions in one set. Try to start sort of slow. Some form of a push-up where you may even be on your knees if your knees can tolerate it, but something to try to keep that upper body strength and core strength up. And these are things that we can have another video on. If people are interested, please like my video, and then we can give some more material on this specific issue. But I would say that the concern about hormonal suppression is probably the number one complaint among patients who get treatment for more advanced prostate cancers. And I wanted to give something out there to help men navigate this. I hope this has been helpful. Please like my video and we'll provide more content.